Thank you so much. Can everyone see that okay?
Yes.
Great. Thank you so much. Thanks everyone for joining us, and it's nice to see some familiar names and faces here. So you're already welcome. My name is Eimear McGlinchey, and with my colleague Antoinette O'Connor, who will speak just after. And we want to talk today about Alzheimer's disease and dementia in people with Down syndrome. And we know kind of before we're starting that this can be a challenging topic to talk about and to hear about. And sometimes people find some of the information a bit hard to hear, but I think it's important to try to present it in a really clear way. But if you have any questions or if you want to talk about it or ask any questions afterwards, you can also get in touch with us. So, so what we're going to talk about today. Everything in the webinar today is about Alzheimer's disease in people with Down syndrome. So we're going to talk a little bit about why this is an important issue for people with Down syndrome, why it's something that we need to learn more about, and why it's important that we do research on that. So we'll talk about what research we've done already, and that was a project called Prevent Dementia DS. And then we'll also talk about some future research that will be happening and how you can take part in that research. So first, just a little bit of background, because sometimes it can be confusing when you hear the words Alzheimer's disease and also dementia. And so they're slightly different things. So Alzheimer's disease is the disease that causes the symptoms. So that's the disease where it creates changes in the brain. Dementia then is the behavior or the changes in how we're thinking that happens because of this disease. So Alzheimer's disease causes dementia. So you'll hear us using both of those words in the talk today. And why is there a link between Down syndrome and Alzheimer's disease? So people with Down syndrome have a higher risk of developing Alzheimer's disease when they get older. And this is because of something called amyloid. And I'll explain a little bit about that now. So as you know, people with Down syndrome have three copies of chromosome 21. And this chromosome produces something called the amyloid precursor protein gene, or we sometimes just call it the APP gene. And so, because this is on chromosome 21, it means people with Down syndrome throughout their lives have more of this amyloid precursor protein gene. And what that means as people get older is that this can build on itself and it can lead to these things you can see in the picture here called amyloid plaques and tangles. And these plaques and tangles are what can lead to or cause Alzheimer's disease. And so that's why there is an association, a genetic association between Down syndrome and Alzheimer's disease. So when we're talking about research and thinking about why research is important in this, so research helps us to understand how the brain changes with Alzheimer's disease and really importantly, what those earliest changes are. And this is important now, especially because we want to make sure that we can, if we understand what those earliest changes are, with new treatments, we may be able to prevent and stop the disease before it starts. And we need to include people with Down syndrome in this research to make sure that people aren't left out of advances that are happening in care. And so the goal of all of this research is really to be able to stop Alzheimer's disease and to stop dementia in people with Down syndrome. And it's through research that we hope to be able to do this. So we want to make sure that people with Down syndrome have the same opportunity as everyone else to be involved in research if they want to be. And an important part of research in dementia is to focus on prevention. So how might we be able to prevent or to stop Alzheimer's disease from starting? So for the next little while, I'll talk about a research project that we have done already. And this was a project, I think some people here today might have been part of this project, was called Prevent Dementia DS. And this project happened between 2021 and 2024, where anyone involved in the project, we met with them two or three times over the years and we repeated the same things over to see if we could see if there been any changes. And so this project helped us to understand some important factors and help us to understand what are the early changes that might happen in Alzheimer's disease in people with Down syndrome. So I talked earlier about how people show symptoms of dementia. So this can be changes maybe in memory, changes in how someone's thinking, maybe changes in behavior. And once we see those symptoms, that's what we call dementia. But as I said, we know that the changes start happening many years before we have those symptoms. So changes can start happening maybe 20 or 30 years before these symptoms. And these changes, we can measure them and see them in the blood and in the brain. But we really want to learn more about them and how we can measure that better. So there are new treatments now in the general population that are showing that they're able to take amyloid out of the brain. So I mentioned amyloid earlier as one of the leading causes of Alzheimer's disease and one of the key factors in Alzheimer's disease. And some of these new treatments can actually remove amyloid from the brain. And so part of the clinical trials that will be happening over the next while and that Antoinette will talk about is really looking at how we can make sure that people with Down syndrome are also included in these clinical trials. And so we can talk about this at the end if you have questions as well. So anyone who took part in Prevent Dementia DS, if anyone is here, you might remember some of these things. So we did a brain scan with everyone where people came into Trinity and did an MRI scan. We also did blood tests. We did some health checks where we found things like blood pressure, height, and weight. Um, and then we also did a number of assessments that are kind of like games. So they're games that will test memory and attention. And we did these with everyone. And then we also asked everyone different questions about lifestyle. So maybe things like education or employment or exercise and those kind of things. And we asked everyone all of the same questions. And we were doing this project in Ireland, but we were partners with people from all over Europe. So there was people from all of these different countries who were doing the exact same thing with people with Down syndrome in all of those countries. So we were able to see if the changes that we see in Ireland are the same all across Europe. We're also able to partner with our colleagues in the United States. So they have a really large consortium in the United States where we're not doing things exactly the same way, but there's enough things that are the same that we're able to compare. And that's really important because we need really big numbers of people to be able to see how important that these changes are. So for the next few slides, I'm going to go through some of the results of what we found from doing this research. And there's quite a lot of information in this. So I know this is being recorded, so you might want to look back. And if you look back and you have questions, just get in touch with me and I'll be happy to talk through any of the questions. So first, what did we find out from doing these thinking and memory games that I talked about? So in Prevent Dementia DS, in this project, we were testing out a new tool, so a new type of assessment that we can use to measure memory and attention and those kind of things. And what we found is that we're able to pick up small changes that are linked to Alzheimer's disease in people with Down syndrome. And so by doing this test, we were able to tell the difference between people who didn't have any symptoms, people who had some early changes, and people who had dementia. And this is important because it's telling us that the test is doing what it's meant to do. We also found that this new test was better at finding these early changes than older tests, and especially for memory, for attention, and for planning. We also, all across Europe and across different languages, people were able to do these tests and they worked well. So these were all important to find out because it tells us that we're able to use these tests to track changes over time, that these are tests that we can recommend or that can be good to use with people with Down syndrome. And also, when I mentioned those clinical trials earlier, it's important that we have something that we can measure things like memory, things like attention to see if the drugs or if the treatment are having an effect. So through this research, I think we can say that these measures, we could use them in clinical trials. We also asked people lots of questions about their health and we looked at their age. And what we found is that, and this was across Europe, that most people who had a diagnosis of dementia had got the diagnosis in their early to mid 50s. We found that there was some health conditions that were linked to having an earlier diagnosis. And some of those health conditions were, for example, sleep problems, so especially sleep apnea, and also mental health difficulties. We found overall that people who had more health conditions were more likely to be diagnosed with dementia at a younger age. And there's also another genetic factor called APOE, which is another gene, and this was also linked to earlier age of diagnosis. Within the study, there was people with different levels of intellectual disability. So some people had a mild level of intellectual disability, some people had a moderate or severe or profound. And we found that the level of intellectual disability didn't have an effect or didn't change the age of diagnosis. And so these findings were important because it helps us to understand that there are important areas of health that we can focus on and that it can help us to improve care and monitoring and planning for Alzheimer's disease in people with Down syndrome. And finally, I said that we did brain scans and blood tests. And for this, we brought all of that information together. So we were able to compare what we see in the brain scan with what we did in the blood tests. And part of what we were doing here is looking at what's called brain age. And brain age means, is there a difference between someone's real age and the age of their brain? And if there is a difference, we call that the brain age gap. So we found in people with Down syndrome, when we compared uh, these brain scans with people without Down syndrome, we found that in people with Down syndrome, the brain can look older than is expected. And where people have Alzheimer's disease, this difference in age, that brain age gap can be about 20 years. So this might mean that if someone is 40 years old in real life, their brain age might be closer to 60. We found that people who had this bigger gap had more difficulties with memory and with thinking. And we also found that it was related to the proteins in the blood tests that we did that were related to Alzheimer's disease. The things like amyloid and tau that I mentioned earlier. We also found that these changes start happening in the brain about 30 years before people get dementia. We were also able to use these brain scans to see how active the brain is and how the different parts of the brain work together. And we found that when people develop Alzheimer's disease, we can see differences in brain activity across the brain. And as people who have more brain aging show different patterns in brain activity. So when we look at the brain scans, we can see where the brain activity is, and we can see that this changes as people move into Alzheimer's disease. This is important because it helps us to understand a little bit more about how the brain changes in Alzheimer's disease and what brain activity is linked to Alzheimer's disease. It also helps us to understand that different treatments might have different effects on the brain based on this brain activity. And again, this is information that we can use and that will be important in clinical trials to measure changes in the brain and also to test some of these new treatments that we can talk about in a few minutes. The last thing I want to mention is something else we did as part of the project called dried blood spot testing. And so this is something that's really new and a really new way to be able to measure some of these proteins and changes in Alzheimer's disease only in the last maybe 2 years or 3 years. Um, and this is where instead of doing a blood draw, like a regular blood draw that anyone would have done as part of the study, you just do a small finger prick test and you get a small drop of blood. And then you can collect this blood on the card and that's sent to a laboratory. And so testing this and including with people with Down syndrome in this is important because we want to know, is doing it this way as good as doing blood tests? And does this work as well in people with Down syndrome as it does with people without Down syndrome? So this would mean in the future it would make it easier to take blood. It may mean that if people are taking part of research, they may be able to do this at home instead of going into a hospital or coming into Trinity or going to a clinic. And we still have to test this. So we have all the information, but we're sending it to a laboratory in Gothenburg in Sweden to analyze this. So we'll have the results of this soon. So that was just a very quick results of the study that we have so far. And I know it might have been a lot of information in a short space of time, but we will have time for questions. Or as I said, if you want to watch it back and then get in touch with me afterwards, my email address and phone number is here. So happy to talk. So I'll just hand over now to my colleague, Antoinette O'Connor, to talk about future research and what's happening next.